Have you ever worked with a patient who felt compelled to share their complete health history with you, or their brother's health history, or their feelings about the lack of breakfast options at their hotel? Conversations with tangential or ruminative patients can be challenging, as you only have so much time with them to address the issues that brought them to Mayo Clinic to begin with. Now, empathic redirection is a tool that can be used to disrupt a patient's digressions in a compassionate way that allows you to maintain that connection while also steering the conversation back on track. So with empathic redirection, we first want to orient the patient with the sound of their name. Next, we want to ask permission to jump in and immediately follow up with an empathic reflection to validate that we have heard and understood their experience. And lastly, we want to redirect the patient back to your mutual goals for the appointment. So in the following video, pay attention to the strategies used to empathically redirect a tangential patient.
Yeah, it does hurt worse first thing in the morning, and it does get a little bit better as I get up and moving, but it never completely goes away. You know, I notice that at work too, because I sit for long periods of time. So if I'm sitting for a long time and I stand up, the pain is worse, and as I keep moving, it does get a little better, but it's always there. It just never completely goes away. So I'm so grateful I'm here that maybe you can find out what's wrong with me. I almost didn't make it here because of the traffic. You guys have so much more traffic here than you used to have.
Well, construction season here, I'll tell you.
Well, you know, there used to be one car in front of me, and I'd kid to my friends back at home, and I'd say, the Midwest, if there's one car in front of you, it feels like a traffic jam. But now I come here,
So
and it's
Mrs.
like I'm in a
Stevens,
big city. There's all these cars. I had to leave
Mrs.
like
Stevens,
15
if I could
minutes
just
early.
jump in here.
Sure.
I'm hearing a few things. One thing I'm hearing is that this pain has been with you for quite a while.
Yeah, it has.
Yeah, it's there when you wake up in the morning. When you stand after sitting at work, the pain is there.
Yes.
The other thing I'm hearing is that this is really important for you to be here.
Yeah, I'm grateful.
It's a big relief. Yeah. So what I'd like to do with your permission is focus on the symptoms that have brought you in, so we can discuss a plan that'll hopefully work well for you. Would that be okay?
Yeah, that sounds good.
Perfect. Okay.
Empathic redirection can be used to compassionately interrupt tangential patients and bring the focus back to the topics that brought them to Mayo Clinic. For additional information about managing challenging patient encounters, I invite you to contact the Office of Patient Experience Patient Communication Program. Thanks for joining me for this Pulse Check.